So we are ready to start. Good afternoon, everybody. Welcome to this important webinar, which is one of several webinars hosted by the College of Humanities at UKZN. We hope that everybody is keeping safe and healthy in the time of COVID. For this webinar, while COVID-19 dominates all our waking and indeed for some of us our sleeping hours, many commentators observe that at the very least, South Africa in particular is experiencing a triple pandemic that is made up of COVID-19, of course, but also the twin pandemic of poverty and gender-based violence. So while our discussion today will indeed illustrate how these pandemics intersect and in many ways how they are gendered, today we wanted to focus our attention on GBV. We have all seen media accounts of the horrific cases of violence against women and girls in these past few months. And as we are slowly opening the university, we wanted to explore how, as a university, we might enhance our understanding of GBV, but also how we might respond adequately to it. To do so, we have assembled a rather powerful panel, even if we do say so ourselves, to talk up to particular areas of our collective understanding and response to GBV. Before we start, I would like to ask all participants to please mute your microphone to eliminate that echo that usually happens during these webinars. Secondly, because we are expecting a biggish crowd, in terms of posing questions to the panel members, we ask that you post these via the Q&A button, which is located at the bottom of your screen. We would appreciate that very much. And we would make sure that we note the questions and have the panel members address some of them. We hope many of them. So we have 4 panelists, and I will introduce them as they come up to speak. First, we have Lisa Vetten, who is a well-known scholar and activist through her decades-long work on understanding and addressing GBV in South Africa and beyond. I have to say as an academic that no self-respecting gender-based violence scholar in South Africa ever completes any piece of work without citing, borrowing from, or leaning on Lisa Vetten's work. You have their biographies in the program, and so I won't really go through the entire biography. So today, Lisa is helping us ponder sort of 3 questions, and I might be wrong. What is the nature of violence under lockdown? And what response or responses have we seen so far? And where are the silences and omissions? And thirdly, what would an appropriate intervention or interventions look like in terms of GBV? Over to you, Lisa.
Thank you very much, Lebo, and thanks for those very kind and generous words. I am just going to put, has the screen sharing started?
Not yet.
Okay.
Yeah.
Okay. Thank you. So what I want to really focus on is a question about a what and a how kind of question. Because our focus today is on how do we implement practical interventions into addressing the problem of gender-based violence. I think to start off with, and in trying to focus on practicalities, you really need to be able to define a problem well and clearly. So I'm going to do a little bit of that, but I think what I would really like to do is provoke questions, because it does feel quite frustrating in thinking about how to respond in the absence of so little information. And as you mentioned, I also want to look at areas where I don't think we are asking sufficient questions, where that's become a kind of shadowy grey area, and where we really need to look far more closely if we want to try and intervene effectively. So I'll start with a little bit with what we might know about the extent of gender-based violence in South Africa under lockdown, but you'll see that it really is very inadequate. So I think even before the lockdown had started, there was a very clear concern, given experience in other parts of the world, that South Africa would also see a really alarming increase in gender-based violence, and specifically domestic violence under the lockdown. So I think that had been seen elsewhere, and when on the 2nd of April, Minister Gbvs announced that 87,000 calls had been received by the Gender-Based Violence Command Centre, it seemed to fulfill everybody's worst fears. Unfortunately, Commissioner Gbvs had been reporting last year's total figures, all calls received by the GBV Command Centre during 2019. So these were subsequently corrected, and you'll see the corrected figures below. So from the 1st to the 26th of March, just before lockdown began, they recorded receiving 4,494 calls. But I think one of the things you have to remember is that the GBV Command Centre might be called the GBV Command Centre, but that is not why people call the Command Centre. They call it for everything from trouble with their SASSA grant to quarrels with their neighbours to information about government processes, etc. So you can see from the breakdown that the Command Centre provided that of those just under 4,500 calls, 133 were GBV related. Then, if we look at 27 March to 11th of April, the first few weeks of the lockdown, you can see immediately an almost doubling of the number of calls they received during this period. But again, the number of GBV-related calls was relatively small. Again, I think just emphasizing the point that we can't necessarily look at the Gender-Based Violence Command Centre as a good source of understanding as to what's going on. And you can see this, I think, in relation to the police statistics for this period. But these aren't terribly clear either. So on the 20th, just after the 21st of May, Commissioner Gbvs released statistics to give us some sense of what had been going on under lockdown in comparison to more or less the same period last year. And you can see a clear decline in in the crimes he presented. So rape went from 5,350 reports from roughly 29th of March to 21st of April last year to 919. On one level, that's not surprising. The lockdown did confine and restrict movement. So stranger rapes, which depend on women or occur in contexts where women are often walking to and from work or going places, one can anticipate that the likelihoods and the opportunities of those happening would have been reduced. So to some extent, you can understand why a portion, certainly not all rapes, would have been reduced. But those figures for domestic violence are somewhat more surprising. We gave 21,000 during the 3-month period last year versus 6,651 this year. But I think the murder figures were particularly interesting because I think on the 17th of June, following the very well publicized murders that had occurred once we started moving into stage 3, President Ramaphosa, in his speech on the 17th of June, said that there had been some 21 murders committed during roughly the start of the stage 3 of the lockdown. But what is very concerning is that 1,072 appear to have occurred during stages 4 and 5. I think that really does raise questions around why we haven't paid attention to what was happening during those stages, and also bigger questions around who died during that period, why did they die, and under what circumstances. I think other questions also come up is when you look at the figures that Gauteng reported to a question in the Gauteng legislature for March and April, and I've highlighted these in grey. And again, they just raise questions because they are so close to the national figures that you kind of do, I am certainly left wondering, as to what is accurate here. So you'll see that they reported 511 rapes, which is more than half of those reported nationally, and some 4,487 assaults, which would be in domestic violence, as opposed to the 6,651. We didn't have sexual assault reported nationally, but I've included the figures for Gauteng. So the conclusion one is left with is what is actually going on here. And attempts to get clarity, I must say, from Gauteng have proved to be quite difficult. But it's quite clear that we are not getting a good picture of what's going on and what we should be doing. So the question, what is actually then happening under lockdown? And I think not just in statistics, in the daily realities of how women, children are trying to cope during this period, what is happening to them in actual experiential terms. I think there are also questions we need to be asking about how do we understand GBV? Typically, I think people use it as an umbrella term when actually I think it's useful to distinguish between rape and domestic violence, because the particular restrictive nature of regulations will mean that we are talking, as we can see from the figures, to a much greater degree about intimate partner violence than necessarily all forms of rape, for example. I think also the way that we frame intimate partner violence in particular as something that men do to women or to their female partners is also giving a somewhat restrictive way of understanding the scope, extent, and nature of violence, which leads to the second question of how do we understand household, because that's really what we're going to be talking about under lockdown circumstances. And I think finally, as a different way of thinking about violence, what is happening to care and support services, who are constituting the bulk of our practical responses under the lockdown? So I'll start with questions about what is happening. And I think possibly most people will remember the murder of Reinicia Korke and her daughter Alticia by her ex-partner. She had gone to apply for a protection order at Belleville Court and appears to have been turned away. And her body was found some 3 days later. The public protector is currently looking at the circumstances of that. So one kind of practical intervention, which was undertaken by myself and in partnership with another 3-4 organizations, was to then start trying to monitor the courts, especially when we received this. This came from another court in the Western Cape, from somebody who'd gone to try and get an interdict application, where you can see the courts had put in restrictions that they're not legally entitled to do and which do not appear in the law. But firstly, they were saying protection orders can only be obtained by those who have experienced violence, whereas the legislation is much broader than that. And secondly, they are also required to first open cases at the police and submit proof that they had done so before they would get an interdict application. So the court's introducing unlawful barriers to protection during this period. So we began the court monitoring process as a way of trying to understand how widespread this was and to intervene. And I must say, as a consequence of bringing this to the attention of the Department of Justice, further monitoring at those courts seems to suggest that the signs like this have been removed and courts are not being closed early. Applicants are not being turned away after 11 o'clock or 2 o'clock in the afternoon. So that was one practical intervention which did have some consequences, and we hope it does increase women's access to justice during this period. But I think the more difficult question is household structure. And here it's useful to look at, and I've taken this from Stats SA, their 2018 and 2011 data, to look at who is living in households during the lockdown. You can see that just under 40% of households are nuclear. Just over 1 in 3 are extended, about 1 in 4 are single, and 2.3% are complex. So clearly there's a complex structure. There are very different kinds of household structures here. Just under 40% are female-headed, and this is typically in rural areas. I think what is also useful to bear in mind, especially given the way the COVID-19 virus appears to have a greater impact on older persons, that while they comprise 1 in 12 of South Africans, they were heading 1 in 5 households in 2011. And I think when we speak of older persons, we are really talking about older women. There are 66 men to every 100 women. And most the majority of elder-led households in the country are being led by women. And they are also far more likely to be living with children than households headed by older men, where the ratio of children is lower. I raise this because this is questions for what we want to ask ourselves about poverty, the impact of grants, and the impact of people living together in extended households where one person may be the only one who has the source of an income through a grant. What might that do in relation to violence during this period? What is happening in households? We can get little snapshots of this. One picture comes from, I think, universities. This has come up both at WITS as well as in conversation with DUT, is that I think students went back to households. So it's correct that they experienced less violence on campus, whether in residences or from rape. But what happened at households was that they went back to violent and abusive households. And in fact, asked to please come back to residence in order to be able to leave those abusive households. And in some instances needed to be placed in shelters. What was particularly difficult, I think, under stages 4 and 5 was that given that students travel across provinces, it was difficult to be able to allow them to get the permits to be able to leave home, to move back into residence or a shelter in order to escape the violence they were experiencing in their homes. I mean, I think what is also clear, and again, this depends on how we understand violence, is that LGBTQ people who do not live who may not be living with their families because of the lack of acceptance towards them, may have needed to move back home during this period, and they too have experienced difficulties around discrimination and abuse at this time in their households. And I think finally there are just the broader questions of family violence in South Africa. We do not have good data on this, and you can see, this is the only bit I could find, is that certainly in the Eastern Cape, that 1 in 8 of the women in those domestic violence shelters were actually escaping family violence, either from adult children where they were, or grandchildren, from adult siblings, and from aunts, uncles, and other family members. So I think that we have a whole set of questions about what is happening in households and families broadly that we're not getting to and perhaps not thinking about. I also want to look at what is happening to care and support during lockdown. We focused, as we should, around healthcare workers, but what about those who are running the domestic violence shelters, the children's homes, other child protection services, and facilities for older persons? And here I'm raising this because I think there are some questions we should be thinking about. An idea that has kind of fallen off the agenda, but I think is worth raising at this point in time, and that is about structural violence. And I want to focus particularly in the Eastern Cape, where I think this is most pronounced. There has been no payment of any subsidies to organizations running services classified as essential under the lockdown since the 1st of April. So effectively, for the last 3.5 months, they have been working without any money. I'm focusing, this goes for the shelters. We've submitted a report this around to the Director General of Social Development. The shelters, fearful of victimization, and the province did not want to be identified by name, but remember that they've had no funds to be able to buy food for those in their shelters during this period, if they have not had additional sources of income. So this impact is looking at child welfare organizations who are looking at child protection. You'll see here 16 of 19 child welfare organizations in Eastern Cape have not been able to pay staff salaries since April. Medical aid has lapsed, pension funds. Some staff are receiving food parcels. These are employed people who will not be picked, so they will not be picked up in the households that have lost jobs. They're receiving food parcels and can't come to work because they can't pay for transport. So we must think about the implications there for child protection. They had no funds, no operational costs. ACVV, which have another 11 branches providing child protection services. By the end of June, 8 branches were relying on loans to pay salaries and staff costs, and 3 were utilizing their reserves. 1 branch was only paying partially their salary, and staff were unable to come to work. The phone line to this office had also been cut. And remember that these are child protection agencies. And as of July, 5 of these branches could no longer pay funds towards salaries or running costs. 1 child and youth care center, and remember these are children who are wards of the state, was not able to buy food for them anymore, and were appealing for food on donations of food on Facebook, had taken maximum overdraft possible, and could borrow no more money. If we shift to KwaZulu-Natal, and here I'll return again to the focus on what we call older persons, but are really older women. And here it's looking at what has been the impact on them of not having sufficient support in order to be able to run their services. So here, KwaZulu-Natal Care Association, talking about buying personal protective equipment that had amounted to 273,000 Rand during the first 3 months of lockdown. Some support received from government departments, but not all. They'd had to find the money elsewhere. This did not come through their subsidies. The Association for Older Persons were in a more difficult position because not all their facilities were subsidized by the Department of Social Development. They were also in a very unfortunate position that some of their residents had been infected by the COVID virus, and they were not receiving support from the Department of Health or the Department of Social Development to be able to do the necessary hazardous waste disposal and the like. So the organization said they were paying roughly 300,000 Rand over this 3-month period in order to be able to deal with both prevention and infection, and the organization itself was projected to run at a loss of 30 million Rand this year. Who's bearing the strain of these care and support services designated as essential under lockdown? It's women. If we look at the 2017 Quarterly Labour Force Survey, which looked specifically at NPOs, you'll see that 69%, so more than 2/3, were female. And if we look at the expanded public works program, then you can see 3/4 of those who are working within the NPO sector are again women. So I think, when you look at this, there's not only the impact on beneficiaries who are receiving what have been designated essential services and told to remain open. There's the impact on those who are providing the services. And I think the kinds of stresses and strains of not being paid, of not being able to adequately feed the people for whom you are responsible is enormously stressful, especially, say, when you start having situations where people do start to die of COVID infections. And so I think the questions then become is this a form of structural violence that we should be thinking about as well, in addition to the acts of actual physical direct violence that we are focusing on and trying to address during COVID-19. So I'm going to just throw those open as questions, I think, to help us think about broadening how we think about what needs to be intervened with and what it is that we can practically do. And then I think simply because we received this question earlier, leave up some contacts around for the National Shelter Movement in KwaZulu-Natal, as well as Lifeline and the Stop Gender-Based Violence Centre, Helpline and Command Centre, in terms of help and other things that we can try and approach during this time, even given the stresses and strains they are being exposed to. Thanks, Lebo. I'm sorry, and I went over time.
Not by much. As you can tell, I had to have Lisa complete her presentation because she raises some rather important questions for us to think about. Remember to pose your questions through the Q&A button rather than the chat button. What we will do will be to move quickly to Ali Shongwe's presentation. So Ali, you are next. Ali is a student activist based at UKZN. Being an activist for Ali means that she is not afraid to ask the difficult questions of us. And therefore, she keeps us accountable in our various roles as members of the academy and indeed as members of our communities and our society. In her presentation, she will broadly be asking and responding to 2 questions. What mobilizes a crisis response, and why are some crises tolerated and while others are not? And what crisis response do we expect to see in terms of GBV in the time of COVID in South Africa? So over to you, Ali.
Thank you. Thank you very much for having me. And my presentation shall be a discussion perhaps less practical than Lisa Vetten's, but as Professor Moletsane said, one that aims to broadly discuss what our understanding of crisis response is, what is effective crisis response, as we've been shown, compared to when comparing the COVID-19 crisis response to the GBV crisis response, as well as what the consequences for poor crisis response are and how it bears on our democracy, as well as potential solutions to the current GBV crisis we're having. So, excuse me. It is extremely noticeable. I think from March, something that was extremely noticeable to me as an activist was the way in which the COVID-19 crisis response was far more effective and far more significant than the gender-based violence crisis response. And the gender-based violence crisis and femicide crisis was declared roughly a year before the COVID-19 crisis, with these completely bipolar responses equally to a crisis. So that was telling in terms of how much our society and our government values medical health and economic functioning compared to social health. So the difficult thing about crisis response concerning any crisis that it requires behavioral change. Rather behavioral change. And behavioral change requires an investment in education and access to that education of what new behavior is required and reflection on old behaviors, as well as incentives to change those behaviors, encouraging that it's actually done. And in terms of the GBVF crisis, exacerbating factors are definitely culture, our social norms, and economic disempowerment of women. And those are major challenges to addressing the crisis at all as a crisis instead of just a normalized mode of functioning and of being, and to solving this crisis or implementing solutions that are effective. And pandemics or crises in general are able to proliferate because of how they complement or work in our normalized way of functioning. And so we either have to change the system and the normalized values of how we function, or we have to change our behavior within those systems in order to properly thwart a crisis and attend to the causes thereof. And this is an especially difficult time that is called for, seeing as we're currently facing, in light of the COVID-19 crisis, we're facing a requirement of behavioral change for one crisis already, as well as another, which has been sustaining for a much longer time. But we're also required to do this in a time of immense social and economic stress and uncertainty. With the increase of social stresses on people, such as employment, economic recession, the illness of COVID-19 itself, and uncertainty thereabout, schools being closed, the functioning of institutions being halted or not continuing as normal. So this is a very dangerous time or rather a very perilous time in the GBVF crisis. I think, please excuse me. So to begin by analyzing the crisis response between the COVID-19 crisis and the GBVF crisis, it is important to look at the institutions that have been mobilized, the resources allocated to addressing each crisis, legislation and policy, and the enforcement thereof, enforcement that is committed, as well as the urgency for solution finding. And across all of those factors, the COVID-19 crisis has been much more effective. The response to that crisis has been much more effective compared to the response to the GBVF crisis. So in considering the amount of GBV organizations existent and available to us, there's quite a plethora of them. However, it doesn't seem to be affecting the efficacy of response to GBV. That the GBVF crisis is highlighted, sure, but the response thereto has not been made very clear, and it has not been progressive. And I think one of the reasons for this is because a lot of these organizations, whether they are local or provincial or national or international, they do not work cooperatively enough. They work in silos. And for this sort of crisis, a more centralized response among GBV organizations is what will do the job. They do not share resources frequently enough, nor are they available, or is their contribution and activism available in all languages, in all national languages. So there's a way in which their functioning itself isn't meeting the levels of crisis. Assistance from the private sector, from the media, and from advertising has also been inadequate in terms of the GBV crisis. I'm sorry, am I being heard? I hope I'm audible.
Yes, Ali, we can hear you.
Great, okay, I'm seeing audio problems in the chat box. I'm sorry about that to those viewers. So what we do require at this point is for GBV organizations to work less in silos and cooperate more. We need clear information about what happens when they are contacted, from shelters to activist organizations. That is something that has been extremely absent in terms, especially in the pressure of being confined to your homes with your abusers, and in considering what will happen to me, to my children, if I call for help. What will happen to me and my children if I call for help? Those answers are not readily available. And so it makes the willingness to contact them and reach for help a lot less if you cannot be certain of improvement to your situation and what is going to happen, especially for more vulnerable people, such as children, and if you are responsible for children, compared to the information disseminated about COVID-19, the protocol of how you will be handled and how you will be cared for if you call for assistance was very clearly laid out across multiple forms of media, across television, radio, and that is what is required. So there's a remarkable difference there between most people not having access to the protocol of how GBV victims and survivors are handled. And in the UN, recognizing GBVF as a global shadow pandemic, there hasn't been much international attention to allocating resources and sharing resources internationally to combat this problem if it is a global problem. And there hasn't been much of a discussion to global cooperation among states to addressing this problem. It's been put on notice, and it's been deemed sort of every individual nation and every individual person's responsibility to just not do it as a UN response to GBV, which is highly inadequate. And I think there does need to be a greater international distribution of resources to particular GBV hotspots in the world, and South Africa would be one of those. So before we move into really understanding the behavioral change required for GBV, our understanding of crisis and how we handle that is generally quite inadequate in terms of how, once the collective symptoms and consequences of a crisis have passed, we confirm that the crisis is over. So once people are no longer coughing, once they're no longer being admitted to hospital, we'll be able to confirm that COVID-19 is over. But we would not have addressed the causes of the crisis, nor would we have addressed the exacerbating factors that remained and that allowed the crisis to proliferate so effectively. So that is a factor we all need to be aware of in terms of what it will take to solve, especially a social crisis, that the true causes must be attended to, and must be committedly attended to, even once we see the numbers of GBV cases going down, hopefully. And if the true causes of a crisis are attended to, although lengthy and requiring more effort, there will be less costs and control of trying to handle corollary factors. I think one person's question mentioned if alcohol really does exacerbate GBV. It does, but alcohol is not the problem. If you address the actual causes of GBV, the motivations, the exacerbating factors, you would not have to so heavily control people's alcohol intake, because even whether they consume alcohol or not, the actual psychological and social causes would have been addressed, or whether people are in their homes or outside, confined to their homes or have access to the outside, those corollary factors wouldn't require so much focus and attention if we just isolate and address the causes properly. So among the reactive and preventative measures required to address a crisis, our government has come up with the national strategy, I should not misquote it. Yes, the Gender-Based Violence and Femicide National Strategic Plan, the progress of which we haven't heard much about, and what we do know about it is very discouraging, as well as dangerous, considering that the GBV crisis was announced with much expectation, and the centralized government response thereto has been near invisible and has not been constructive. So the short-term and long-term solutions for the crisis, which are addressed in the National Strategic Plan, don't clearly speak to the urgency of the crisis, and the vision included in the plan doesn't provide the public with enough incentives required for the behavioral change. So incentive in terms of truly imagining what a society without GBVF looks like and why we would want such a thing. It's assumed that merely by saying we have a vision of a South Africa free of GBV and free of femicide is enough to motivate response to make that happen. But because of how culturally coherent GBV and femicide is in our national context and in our societies, there is more persuasion that has to be done. A vision needs to be illustrated to the public and shared in multiple forms, especially across media or in advertisements occurring not only in media, but also in stores. So in workplaces, in schools of what a truly gender equal and secure society entails for all of us, the benefit for all of us, and why this will be better than what we have now. So there is not much vision, or there's not much collective awareness of where we're going and where we hope to be going once we have ended gender-based violence and femicide. So yes, in terms of how culturally pervasive gender-based violence and femicide is, which also I think creates, or which I think also makes it very particularly difficult to solve as a crisis compared to a medical crisis like COVID-19. Sickness is not culturally coherent with how we live our lives, how we participate in institutions, and so it's very contrary to the ways in which we normally live. It's isolated, it stands out, it's peculiar, and we want it gone. This is something that is culturally pervasive, and due to this cultural pervasiveness, it almost evades the label of a crisis at all, as opposed to just how things go. So even naming GBVF as a crisis in 2019 was an achievement in and of itself, that this is not just how things go, this is a matter of security. So
would you conclude, Ali? Sorry about
sure.
that.
No, that's okay. So there are many technical solutions we can use to address gender-based violence right now, especially as we're becoming more and more dependent on online working spaces and online education, such as gender and sexuality classes and courses, from the early childhood development level all the way up to employment spaces, or online, so finding these online for school children and for the public interest, enforcing mandatory sensitization into gender equality in workshops in all private and public institutions, utilizing neighborhood panic buttons or a neighborhood watch as a ground level communitarian response trying to fight GBV, especially as the monitoring, evaluation, and adjustment by government from top down is quite visibly failing us. So to conclude, I definitely think that these need to be considered as we adjust to the new normal of how we can incorporate these not just into physical law enforcement, but into our own community ground level action through online measures. In terms of taking public responsibility for the GBVF crisis as we have for COVID-19 crisis, seeing as our official law enforcement and government is failing at thwarting it on its own. Thank you.
Thank you, Ali. Again, remember to pose your questions to Ali and other panel members through the Q&A button. Thank you for that comprehensive presentation, Ali. Next, we have Tlaleng Mufokeng, who is a medical practitioner, what I like to think of as a medical practitioner with a social conscience. Dr. T, as she is known in South Africa, is another activist who goes where many of us dare not. She is well known for her activism, particularly around sexual and reproductive health and rights. In fact, as evidence of her fierce and tireless work on this issue and at the local and international level. She has recently been appointed as UN Special Rapporteur on Right to Health. Today she speaks to us, though, as a commissioner on the Commission on Gender Equality. Over to you, Dr. T.
Thank you so much, Rilebohile, for this gathering. As per the Government Gazette of the 25th of March in 2020, the Minister of Corporate Governance and Traditional Affairs included the Commission for Gender Equality as one of the services listed to provide essential services during the national lockdown. And in light of those gazetted directives, we were able to then, through our mandate of the Commission, our Act 39 of 1996, as well as the Promotion of Equality and Prevention of Unfair Discrimination Act, which is PEPUDA. This is what we are leaning on in terms of legislative frameworks to execute our role and our mandate through the national lockdown that arose because of the COVID-19 epidemic. And what we want to reiterate as the Commission for Gender Equality is that our country, South Africa, is an open democracy committed to the fundamental human rights, which include the right to equality and inherent dignity of the person. And amidst the declared disaster and the regulations, and of course the various government interventions, we ought to observe and defend these human rights. And therefore, as a Gender Commission, as well, of course, conveying these messages to the members of the public as well as stakeholders and of course the government, that we are available to exercise our legislative role during this lockdown in the spirit of cooperative governance. And of course, we firmly believe in the Constitution of South Africa. And it is important for us as a Commission to ensure that those who are at the periphery of society, based on certain vulnerabilities, such as extremes of age, gender identity, sexual orientation, poverty, migration, many of the communities in South Africa are still without clean, sustainable sources of water and electricity. And all of these various vulnerabilities make people even more vulnerable at the time of COVID. And we need to be deliberately inclusive in all the solutions that we come up with in terms of policy, issues of access to services, and of course in terms of resourcing. And institutions of higher learning are important spaces where many young people are transitioning from childhood into adulthood. And some of these conditions and vulnerabilities that I've spoken about keep them from thriving. And violence is one of them, drug use is one of them, abuse, homophobia, anti-Blackness, misogyny, and we know the issues of academic exclusion due to a lack of financial support. So COVID-19 as a pandemic, as a health global pandemic, is happening at the back end of all of these other existing problems that we know we have in South Africa. And so at the Commission, what we know for sure is that, like many people who work in the sector, there was an anticipation and an anxiety around what will be the issues that are affecting people who are surviving violence or who are already living under the threat of violence, whom under lockdown are unable to access public transportation to get services, or are unable to have money because many people were not paid to be able to then make those telephone calls to ask for assistance. The issue of food insecurity remains a big problem for us in South Africa. And when it comes to specific issues around gender-based violence, as a commission, we are able to receive complaints, but we can also investigate complaints out of our own accord. And in our own internal mechanisms of monitoring at CGE, we did notice that in terms of reported GBV cases, the highest numbers of increases were in the Western Cape, followed by KwaZulu-Natal and Gauteng. And when we looked at the numbers for 2019, for the lockdown period that we measured, we had 22 complaints, that's March to April. Whereas in 2020, we've had 60 complaints in March to April. There was a 2.73% increase, sorry, not percent, 2.7 more times the normal average for us. So definitely for CGE's own statistics, we have seen and noted that increase. It is important, of course, as we perform our monitoring and oversight role of other government departments and entities that are tasked with responding on GBV issues. It's to note the point that statistics at the moment are not easily forthcoming. And we do have old systems, I think, of monitoring and of data collection generally in the country, which makes us to not be able to be immediately responsive and be as agile as we would like, especially on these important issues. So the Commission has been actively assisting on the issues, but not limited to child maintenance matters. We continue to assist people with sexual harassment, and particularly in the workplace as well, as a space for that we know for violence for many women and those who are of gender or sexual minority. The issues, of course, to this end, any investigation will take a form within the circumstances of any complaint, and where we need to, we are able to assist the complainant with court access. We know the issues of justice delayed is still justice denied. And for many people, the idea of entering the justice system, whether it's through policing or eventually when people get a court date, it is quite anxious and overwhelming. So where it's necessary, we are able to assist people with accessing of courts, but also be present. We also handle complaints because some people may come to the Commission many months or even years after they have reported a gender-based violence or femicide case or sexual assault or rape or domestic violence. And so in those types of cases, with the case numbers, we are able to assist them get in touch with IPID or the SEPS offices, and sometimes to the Minister of Justice as well. And we also help with referral of complaints to other relevant authorities, as well as law enforcement agencies. And most of the time, and the complaints that survivors have, it's the tiniest response that is required. And most of the departments, we know cases can go on for many months and years. And what we try to do is really be impactful in terms of ensuring effective and timely responses to a lot of these problems, which are urgent for many of the survivors. And we look at ourselves, and of course our act calls on the Gender Commission to act as a catalyst and to monitor and ensure that all stakeholders are rendering services, and they do so without unreasonable delays. With reference to GBV complaints, we are not a service provider per se, but we don't offer services such as counseling or places of safety, but we are able to assist complainants in this regard. And we do have a network of non-governmental organizations that often we lean on, and of course the National Department of Social Development. Our 9 provincial offices are also much more closer to the communities and when they are needed in terms of psychosocial support, which we know has been crucial, especially during national lockdown, in terms of food insecurity, which is in itself a form of violence, but of course in terms of counseling, where we've had people who have been unfairly dismissed and they may not have come with complaints of physical or sexual assault or violence, but there is something to be said about the nature of our economy and what it means for women who are still underpaid, overworked, in unsecure jobs. And what we have done as the Commission in the last few years is that we have been engaged in a process of public investigative hearings where we have ongoing investigations into the state of shelters. And in this investigations, we've been analyzing all the 9 provincial social development offices and took a sample of the shelters that they support. And in the financial year of 2019-2020, we had the departments, the head of departments of the 9 provincial DSDs, as well as the Director General and the DGs of the National Department of Human Settlements and National Treasury. And what was important for us was to get a deeper understanding, but also advance the issues of gender equality through these departments in how they deal with survivors. And they appeared in front of the commission. They responded to a series of questions regarding how shelters are allocated resources, the functioning, and importantly, the coordination of shelters, including transitional housing, which is something that's still lacking for us in South Africa. We know the many non-governmental organizations which offer this work and support survivors of violence still depend of some form of subsidies from the Department of Social Development. So one of the important work we've been doing, it's about contract management systems. It's about the issues of delayed payments to women and communities who are doing this work when the department is often unable to provide this work. And it's important to talk about the fact that there still are groups of people that are unaccounted for when you talk about sheltering, whether you're talking about the national response to GBV, and it's persons LGBTIQA+, right? Where even the policy isn't clear currently in terms of sheltering, and a lot of them don't comply with the basic rights of access around the dignity of LGBTIQA+ persons as afforded by us in the Bill of Rights. And that you find a lot of transgender people are turned away from shelters. Lesbian women often find difficulty with accessing shelters. Another important point was that even where people have to give feedback, or there's complaints, or there's issues of not being or discrimination, let me just say, where people feel discriminated against, there isn't a clear pathway of communication where the service user, the end user, can then give feedback. And we think that's important, because at the end of the day, all our efforts should be about improving the lived experience of survivors. And if survivors are unable to feed back into the system about what works and what doesn't work, that can also be problematic. And we also, of course, which is another important thing, and it's been good to finally look at the work of the National Strategic Plan on GBV, is that we have an opportunity as the Gender Commission to further use our mandate to monitor and perform oversight of the council that will be formed for the NSP, on the resourcing of the NSP, and as well as implementation of the NSP. And we know that monitoring is important. It is important also to have clear indicators, because what has been missing, I think, all along, is that survivors spend 2 months in a shelter, but when they leave, we are actually not sure what then happens. Are they adjusting favorably back into their communities or back into their homes? And more often, women are leaving and fleeing their homes. So when they leave a shelter, are they going back to that same environment? Are they going back to their perpetrator? Which is why it's important to then think of the entire justice system and really fix all of the different moving parts all at the same time, so that regardless of where the entry point of the survivor is, they are guaranteed that they will be assisted, that their dignity will be restored, and that everyone is committed to their healing. And so through our legal clinic, the public education and advocacy outreach, and of course our research unit at the Commission, we aim to continue with this work, much more so now because we have an NSP that we can do monitoring and oversight on, and make sure that even our own provincial offices become closer and closer to the communities where we are really needed. And if anyone wants to get hold of the Commission for Gender Equality, our toll-free number is 0800 007 709, or email us at complaints@cge.org.za, and I will take these contact details and put them in the chat as well. But it's definitely our view as the Commission for Gender Equality that the structural fault lines must be systemically corrected. And for many people, when they flee a situation of gender-based violence. It may be their only chance, but so many more survivors are living with abuse in silence. And it will take every single one of us to break the chain of silence firstly, but ensure that survivors are able to be assisted regardless of where in the system they enter for assistance. Thank you so much, Rilewile.
Thank you, Tlaleng. You raised some important issues there, significantly helping us see the CGE as a resource that we can go to in terms of our efforts to address gender-based violence in institutions, but also in families and communities. Our last panel member is Angeline Stevens. While she is officially the manager, student services support in the College of Humanities at UKZN, we have come to see her as our go-to person on issues related to our well-being generally. But also issues concerning how we respond to GBV as a community. So over to you, Angeline.
Thank you, Prof. Molitsani. Good afternoon, everyone. I'm really happy and pleased to be part of this really important dialogue. So our title, Understanding and Responding to Gender-Based Violence in the Time of COVID-19 and Beyond, New Strategies and for New Times. I'm going to tackle it by framing it in a long-standing debate where we looked at the private and the public divide. And the reason I'm doing this is because I work in the support sector, and we grapple with these issues. Now that our students are no longer on campus at residence, the dynamics have changed, the context has changed. So we also, it raises a whole lot of new questions for us in terms of how we do what we do. And for me, that has brought this discussion, this long-standing debate, what is private and what is public, to the fore. And I'm actually quite happy that I've come at the end, because all the panelists that have come and spoken before me have already touched on this. And it's really, for me, what is at the center here is who takes ownership of gender-based violence and violence. So right now, as we talk about it and talk about the different aspects as well, how do we engage with this topic? So is it just something that we are doing in an academic, abstract way? So in other words, my question is, are we doing something to a group of people? Or how do we actually engage with it? And that brings me back to this whole, what is private, what is public? And when I mean private, I'm talking about the personal, individuals, our students, staff, community. And when I talk about the public, so we're talking about the institution, so UKZN, for example, but our government, our communities. And I also want to start by saying that I find the whole defining gender-based violence and violence as a crisis, as a pandemic, problematic. And I find it problematic because we've been grappling with it for a long, long time, before COVID even was on the scene. And we have a really nasty mechanism. We have a stop-start switch, I think, when it comes to violence and GBV. So we tend to be very reactive when there's a spate of violence perpetrated. And often it is women, but it's not just women. Okay. But for the purpose of today, I'm going to mainly be speaking about women, but it can't be men, it can be children. We tend to, something comes in, and the word crisis is exactly that, from in psychology, when we talk about someone presenting in crisis, at that point, our main goal is to contain the person. so that we can then work with issues. And I think that's what alarms me here as well. So that it is, and Ali has wonderfully touched on this as well, the concerns that when we are talking about violence now in the context of COVID-19, it's like there's this urgency, yes, because we've noted a spike in the number of incidents of violence and GBV. And even the reasons that we have attributed to the spike, some of it rests on personal, individual factors. So we've talked about things like low frustration levels, increased frustration levels, low tolerance levels, increased anxiety, maybe poor coping mechanisms for dealing with events that are considered stressful, poor communication skills, poor conflict management skills, and that is coupled with things like how do we adjust to how our context has changed, right? So there's a sense, a loss of life as we knew it before COVID. There's restrictions on our movements. So there's a whole lot of adjustments on a psychological level as well. And of course there's the whole talk around substance use and abuse, and that might be a factor that contributes to violence and gender-based violence. And again, from the public in a systemic point, job loss, the threat of job loss, the whole instability around finances, the disruption to the academic calendar at school, at universities, the huge impact in terms of poverty, socioeconomic hardships. That has been one of many reasons that have been cited for perhaps why there is an increase in gender-based violence and violence generally. And again, even if we look at the effects of it, we sometimes think of it in terms of the individual. So we know that there's significant mental health effects. So depression, post-traumatic stress, suicide ideation, suicide attempts, actual suicides. There's also the cost to, on the public side, our health systems, our social legal systems, the policing system. So the cost of it is really huge. And again, we can kind of divide it public, personal. But my question then is it really public or personal? And I think we often are trying to arrive at that in terms of who takes responsibility. When I look at what we see unfolding, what has unfolded in the COVID-19 context, I think we're just bursting at our seams in terms of the resources, right? And that has really brought to the fore violence and how then do we manage violence? All right, so the government has responded by implementing, for example, the National GBV Command Center. They've strengthened support systems. And of course, the government has also imposed a ban on alcohol sales. It was briefly lifted, and then the ban has been imposed again. Now, when we do things, and I'm not in any way suggesting that that is not needed, all right, that we don't need to strengthen support systems. We do need to do that. My concern is that we are still only focusing and doing something to what we see as a group of people. So we've spoken, we highlighted quite a few risk factors. We spoke about poverty, for example, and how impoverished communities or older, Lisa mentioned like older women with disabilities, persons who identify as queer, persons who come from rural and culturally diverse backgrounds, they might be more vulnerable to the incidence of violence. The problem with a risk model, though, is that it also perpetuates certain misconceptions around violence and gender-based violence. For example, violence might only be happening in impoverished communities where there is, where substance use is rife. So that kind of thinking not only further marginalizes, stigmatizes and discriminates against marginalized groups, it also silences violence that might be happening in other communities. For example, affluent communities are ones where people do have access to support systems. So the long and short is, I think what I'm trying to say is that while this is important, it also takes away our attention from what is causing this. So are we saying that in the absence of alcohol, there is no violence? Because we know other countries are also reporting a spike in violence, all right? What are we not doing, or what are we not doing enough? All right, that brings us to the point of why we're saying it is now a crisis. So I'm going to suggest that what we need to do, what this whole pandemic has brought to the fore really is that it shows us, it tells us that it's really time for us to disrupt and to break this public-private divide, that we really all have to take responsibility in our spaces for violence, for gender-based violence. And here again, it would go then from an individual level to the broader context. So thinking to just UKZN, thinking from my own work in the support sector, how would psychology as a practice, what shifts does it need to make now to respond in a more effective way, given that most of our students are not at campus, so we're not having that contact with them the same way that we used to. We are not surrounded by our established networks that we used to rely on. Our students are no longer just, university, and I've said this before, offers quite a degree of protection despite the incidence of violence at university as well. So our students are no longer at residence. Home is now the learning context, but they no longer just by themselves, they are just with their peers. They're either parents themselves, dealing with children. And remember, children are also exposed to a lot of vicarious trauma when they see violence and they're exposed to violence. They might be caregivers themselves. They have a whole lot of other responsibilities aside from perhaps also being subjected to violence themselves. So what do we need to do differently now so that we are able to respond in a meaningful way to the kind of support that we provide our students? How do we equip them with or empower them in ways to deal with their challenges? And there is still a place for psychosocial support. But again, it comes back to the whole divide between the public and the personal and the public. For example, when someone experiences violence or rape, there's a lot of feelings of shame and guilt, and you need to work through those. But you also got to ask yourself, where is it coming from? Why are there those feelings of guilt and shame? And if you think about it, a lot has to do with how we construct violence and GBV. So we hold the survivor accountable. You must have done something to provoke it, all right? And so we don't see it as a social problem. We often divorce that. And so again, I'm saying there is that tension that we need to break that. Coming to UKZN then as well, if learning is going to be happening a lot at home, and we know that our students are going to be exposed to multiple forms of violence, and we often overlook the psychological component of violence, but yet it is really, really something that can be very far-reaching in terms of its consequences. What are we going to do differently as an institution? We've spoken a lot about how we need a multi-pronged approaches that link in a coherent, integrated way how we deal with gender-based violence and violence at our institution. So we need to also now extend that. If our students are in communities, in effect, the communities have come closer our learning space at UKZN. And it's really this whole geospatial dynamics has changed. So how are we going to change that? So if we talk about our curriculum, for example, and we've already in our college, and not just in our institution, spoken about the need to have, for example, a module on citizenship that starts to look at issues around power imbalances, masculinities, and all of that that impacts violence. How does this now need to go into the community? How do we bring in the community more into what we do and how we design? And then from there, it also obviously extends to what is happening nationally and how do we from here, from the ground, feed into policy development nationally, and how does what the government implements and designs link to what is really happening on the ground? You know, often we are left asking ourselves when we get a student, for example, that comes to us wanting some kind of support, sometimes we really come up against a wall because there's so few options that we can turn to. So there is that absence of support. But let's say that we did have that support. And I was reading some of the chat, some suggestions that are made in terms of how we can address this, like removing the perpetrators, etc. It still would not, in my view, really deal with the source of violence. So we've spoken about, the previous panelist has said, we need to work collectively. We all need to come together. And so that is really what it is about in our respective spaces. How do we change what we're doing currently so that it does respond to the changing context here? And so that means also looking at our own behaviors, our own values that we might be communicating and perpetuating in the work that we do in our conversations. You know, memes are part of life now, and how often might we be laughing at something that really perpetuates a stereotype about women or queer people? So what are we doing to challenge that? So I'm suggesting that for me, what this current COVID-19 pandemic and the escalation in violence, what it is highlighting, it is that it is really, really time for us to make and to think long-term. What do we need to do to bring about long-term changes where we can change mindsets, bring about that kind of change in mindsets? Ali spoke about behavioral change, and to get behavioral change, you've got to bring about a mindset, a change in that. So you cannot do it in isolation, where we just look at our university, for example, as a community. You've got to look broader. So that level of engagement has to go deeper, and it has to be really much more real, for want of a better word. So I'm going to stop there and really leave all of us here, just maybe perhaps in thinking about this, the topic, start by looking at what is it that we would all need to do to bring about some kind of shift. Thank you, Lebo.
Thank you, Angelina. We want to move quickly to our respondent, Janine Hicks, who is known for her role as a former commissioner on the CGE, but also her work around these issues from the perspective of the School of Law at UKZN. Importantly for us at UKZN currently, she leads the task team that is charged with developing our response to gender-based violence on campus. Over to you, Jenny.
Thanks, Lebo, and good evening to everybody. I'm sure we're anxious to get to the very long list of questions that I see flooding. So I've just pulled out 2 or 3 points from each of our speakers, really just to problematize or offer back to our listeners. So we start off with Lisa's presentation, talking to the nature of violence under lockdown and the kind of response that we've seen, I've drawn out 3 key points, Lisa, that I thought were critical, that we can see if there are further questions on this. A key thing you've spoken to is the accurate statistics. We don't have a clear picture. How do we ensure that we get the accurate statistics that inform our response? How can, you've spoken about the command center, that it's not a good source, that we've got confusing statistics. We don't have adequate data on victims. How should this be corrected, and what should we be calling for to correct the statistics that are available? Secondly, you speak to how do we understand gender-based violence? What are the experiences of women and children predominantly? What is the nature of gender-based violence that is being experienced, particularly now, distinguishing between rape and domestic violence, the role of intimate partner violence? You're also drawing on the need for greater information on household structure, poverty, the lack of income, and how this is impacted on gender-based violence. So you've identified a slate of issues around our actual understanding of gender-based violence that needs to be corrected. My question there is, have you identified a new niche or need for new research? What is missing currently in terms of our understanding? And who should be taking this up? Should we look to UKZN, other research institutions? What qualitative data are we lacking right now to inform our response? And then thirdly, you talk to the response and resource allocation, noting particularly vulnerable groups. But I think what struck me really there was your speaking to structural violence, and looking at inadequate responses from the Department of Social Development and the Department of Health. How do the inadequate response that we've seen, how does this tally with the state commitments to the gender-based violence crisis? How do we raise this issue again? Yet again, we're talking about an inadequate response by the state to instances of gender-based violence, inadequate funding for shelters. What do we do differently? How do we get enough attention on this? What else should we be doing to get an appropriate response? Dear Ali, you drive us to 2 key points. You talk to systems change and you talk to behavioral change. Critical areas there. I love that you're looking to the global. You're talking about a better United Nations response and a better international distribution of resources. Is this something we should be tasking UN Women? How should we be unlocking this as South Africa? We represent and sit on these structures. What should we be doing better to access and escalate this global cooperation? You talk really importantly to the state, you talk about the need for state system change, so global system change, but our own state as South Africa, our institutions that we make available, the resources that get made available, the enforcement. How do we muster this adequate state response? And you draw us correctly to the National Strategic Plan on gender-based violence. And I think really the elephant in the room is, where the hell is this at, right? But again, you talk about the need to address the causal factors of gender-based violence and social stresses. And I think a critical question you ask, if we're to change state response, is, are these causal factors and social stresses being adequately understood and fit into state design of its response? Lastly, in terms of systems change, you talk about the need for better collaboration, sharing between, response organizations. And I'm just wondering if this isn't a bit unfair. We know that our NGOs and our community shelters are under stress to survive. They are the front line, and we're telling them that they need to organize themselves better and share better. I'm just wondering, if requiring them to be better at organizing and networking is just not something that is too much to be asking at this stage. At the behavioral change level, really a key question, you're talking about the need for more education, more incentivizing. What should we be doing differently? We've had our hashtag #MeToo, our hashtag total shutdown. We've had protest, we've had outrage. how should we be working differently to change mindsets and change behaviors? You speak beautifully about the need for collective visioning of a society without GBV. So instead of the outrage and the demand, we should instead be moving to the more beautiful vision of why would we want a society and families without gender-based violence, and bringing people on board with that vision. But how do we mobilize this differently, and how do we support it? Dr. T, now I'm thinking Mr. T, Dr. T, three key things for the CGE. You've heard the concerns. It's wonderful to hear, first of all, the take-up of this space that the CGE has instigated during lockdown. We know only too well that the CGE has a very limited footprint and limited community access, but you are strategically placed to inform and demand state action and response. So I think three key questions for you as the CGE. How can you help us with the statistics confusion? It is key to our understanding the extent and nature and incidence of gender-based violence. You heard the points that Lisa raised. Can the CGE take this up and demand that we get a better response from the state in terms of organizing and making available these necessary statistics? Secondly, you've heard Lisa and Ali talking about inadequate state response, inadequate support, inadequate institutional arrangements, inadequate court response. The National GBV strategic plan is key to this. It's good to hear that the CGE is monitoring this, and you spoke specifically about the forming of the National Strategic Plan and the resourcing of the National Strategic Plan. I'm sure many colleagues share my real disquiet. We know the years, really, the years we lost to the Gender-Based Violence Council, the collaborative initiative that fell under the Women's Ministry that was meant to bring all the partners together to, with the pillars of intervention and the national gender-based violence, the 365 days. Please help us not repeat the disaster of the gender-based violence, the National Gender-Based Violence Council, and how it failed us. What are we going to do differently here? The CGE had a wonderful study on the GBV Council. It would be wonderful to hear that we're learning from our mistakes in that regard so that we don't repeat these with the Gender-Based Violence Strategic Plan. And finally, it's great to hear that the Department of that you're taking up the issue of DSD support for shelters. I'm really keen to hear what response we're likely to see. Finally, my colleague Angeline, who sits with me, and Lebo on the Gender-Based Violence Committee, you talk really two key points that I wanted to draw. Again, this point of what shapes and causes violence, and the need to have a better understanding of that to inform our response. You talk about the need to perceive violence as systemic rather than a crisis that needs curtailing. And as systemic, this requires long-term solutions that address those causal factors. My question to you is, do we have this information? I was asking Lisa, do we need more qualitative data and research gender-based violence? You speak about the need to change mindset, change behavior. How do we trigger that mindset change? I think for the second point, you do bring us to this because you talk about who takes ownership for this work. I think the public-private dichotomy is, we can get distracted by that. I think you're directing us to actively and all be acting in our own individual sphere of influence, whether that's as a family, as a university, as a province, as the state response. What I'm hearing is, rather than sitting back and leaving the GBV response to some crisis command center, sounds like some Star Trek-y, somewhere up there, the command center is dealing with the crisis. I think you're saying the crisis is here, it starts with us. We should be taking on individual ownership. But I think, we can problematize that and say, how are we going to be doing that differently? I hope that assists you, Lebo, and then looking to the kinds of questions and responses and can help inform our discussion. But thank you all for great inputs.
Thank you, Janine, for summing up for us those 4 presentations. I think in the first instance, I would like to let the panelists respond to the questions that you just posed to them in the order of the presentations, please. So starting with Lisa.
I hope I can remember all of Janine's questions. They were, and also not take an hour in which to respond to them. I think the questions of statistics is really a very important one. I think there is a need to have a conversation, and possibly if the CGE could take us up, this would be very helpful. There is a need to have a conversation with the Minister of Police, as well as possibly Statistics South Africa around what they have. I do know government is trying to collect statistics routinely from some of the shelters and counseling organizations. So they are trying to get information in, but they've also got to share it. So I think, you know, in trying to understand the situation now, those are places to look at. But I think it's also, there's a much bigger, longer, deeper question around statistics in South Africa. And it's why I am reluctant to describe the current period as a crisis in some ways in relation to the numbers. I think it's important that when we start talking about statistics and the incidence of violence in South Africa, we start doing so historically. And I think if we look historically, and it's why I disagree that organizations have had no effect. If we look historically, the high points of violence in South Africa against women in the last 30, 40 odd years was really in the 1990s. Dubious as the reported statistics might be, more reliable. The murder stats are more reliable because there you don't have quite as much a problem as underreporting. It's quite clear that the high peak was in the 1990s, and that there was a definite tapering off of numbers, specifically in relation to women's homicides and men's, from the late 1990s to 2012. So Janine, if you want a research question, here is one. Clearly there was an effect being had on violence in South Africa during that period. What is it that changed around about 2011, 12, and 13 that has put us back up on an upward trajectory in homicide? How is homicide gendered? Because every year it's going up for men since that 2012, whereas for women, some years it's going up and some years it's decreasing. So I think the whole question of how gender is shaping and influencing violence is very important. I think it's also the challenge to us when we start talking, let's think systemically, let's think behavior change, is that it has to be located in a much better understanding of both past and present and how they are enacted. Because violence is clearly dynamic. It is increasing, it is decreasing. What are the factors that are going into that? And I think if we're going to think about a broad way of understanding gender-based violence, the fact that these numbers shift and change over long periods of time clearly tells us that we need to be thinking about more than just questions about gender relations. It's what else is going into those relations that is shifting it. So it's not just questions of men's power over women. There are clearly other things operating that it shifts and changes at time, which may be questions about legislation and its effect, maybe questions about alcohol, maybe questions about broader economic trends in the country. So if we want a research agenda, I would really start looking at, challenge us to think not just at small cross-sectional surveys that look at a point in time, but to start doing the kind of longitudinal studies that track trends and also start to measure different things, test the impact of different kinds of things over time. Because I think you talked about different understandings of gender-based violence, Janine, and this goes to statistics, is that it's very clear, if we look historically, that how we have understood gender-based violence has also changed over time. So we're not even necessarily talking about a constant problem. We're talking about a problem that's undergoing changing definition all the time, which, you know, also becomes a bit of a challenge in terms of what sort of statistics you're collecting, who's reporting, and what they're reporting. So that was an attempt to try and address some of your questions.
Okay, thank you, Lisa. Ali, do you want to give a response to one or two of Janine's?
Definitely. I wanted to take heed that it may be burdensome for our response organizations, which are currently very pressurized in responding to GBVF, to organize a network. But the burden need not be on them individually. They can be recruited into a network that is organized by a most capable actor among the collective, or an independent capable actor from outside. Because the result of being more standardized, the result of being in a network would be towards all organizations' benefit in terms of the availability of resources and recycling resources as well for each organization's use therein, so sort of sharing. Having a standardized and coherent national ground level response to GBVF that is more focused and more obvious no matter which province or city or region you're in, and having each other's mutual assistance. The government managed to do this in terms of collecting all the relevant GBVF organizations. The government managed to do this quite well, except for their own purposes, in the consultation process of creating the national strategic plan. It's just that sadly, the result was that the insight they gathered from consulting all of these organizations, from bringing them together and consulting them, has not been used effectively in terms of the implementation of the national strategic plan. And to address how international cooperation can work better, especially by the UN in addressing GBVF, it can work on the basis of, I would like to suggest a perspective change, as seeing GBVF as a security threat, which is something international organizations respond to. They find it actionable, and a global security threat, instead of just that's the one that is globally available in all countries, as opposed to one state actor against another. Especially when considering that GBVF takes more lives than, well, among women, takes more lives than malaria, cancer, and car accidents combined. We need to introduce the understanding of GBVF as a security threat for our international organizations to solve, and it would be more effective for this to be collectively solved simultaneously on a global scale than in one country or region at a time, especially for fair distribution of resources from countries and organizations that have the most, directed to those countries and organizations that need the most assistance. Yeah, and I think there was, sorry, I forgot Janine's last question, but I think it concerned how behavioral change needs to be inspired, and understanding the causes of GBV. I would suggest a more activist approach, which I'm sure was expected from me, but similarly to coming out of a regime and a society that was extremely racist, having social values of non-racialism aren't adequate, as we've seen. You would need to have social values of anti-racism in order to reestablish a society without the immense influence of a prolific, oppressive regime. And so similarly, we need to introduce feminist values into society as normalized ones, and as ones that are going to accommodate for the immense influence of GBVF and guide us to a vision of a society where we all substantively have agency, fulfillment, and security, which is the basic standard provided in our constitutional order and in that constitutional aspiration of what South Africa should be. So I suggest a few perspective changes.
Dr. T, sorry, I forgot I was muted.
Thank you so much. So yes, the issue of statistics And I think what was actually more concerning was how they were covered in the media, because, you know, then people were making, you know, statements about, you know, the connection with alcohol or not alcohol. And we knew at the time there hadn't been enough time to make some of those bold claims that were made at the time. And we do have different mechanisms at CGE to get information. When a complaint has been laid and we need specific information related to that, we are able to, within that part of that complaint or handling that complaint, case management, request certain information from different entities, whether they're public or private sector or government. And in terms of our research unit, we do actually also embark strategically on different research topics. And a lot of what ends up you know, being decided very much leans on our annual performance plan and our strategic 5-year plan. And gender-based violence is a big thematic area for us institutionally. In terms of our legal department, we are able to also write letters of request for information. Where appropriate, we are also able to issue subpoenas to different respondents in pursuit of information. And this can also be out of our own accord. So we don't necessarily always have to wait for a complaint before we act on this. And as part of our public hearings that we hold at the Commission, we do use this a lot to gather information. And often in the lead up to a public hearing, we do call on different experts who do you know, give us advice and opinions to the Commission as well. In terms of the current COVID-related GBV statistics, we are having monitoring of our own call center. We are monitoring the emails and the complaints that are coming through. And like one of the panelists said earlier on, you know, the calls that come through are not only related to violence. There are so many other areas where people are struggling. And so it's just about optimizing our systems to sift through quickly and capture that information. But what we need, I think, is more technology, you know, within the public sector that's able to red flag or put a red flag, you know, on all of these cases. For example, we need some innovation, you know, around how a case number and a DNA kit should be able to be paired together and be tracked electronically, so that even as a complainant or a survivor, you should be able to know that your DNA kit is now actually at the forensic lab. You should be able to track using your case number who your investigating officer is at SEPS. All of those things are about innovation and using technology and the networks that exist to further improve you know, access to care and services and definitely justice. And one of the problems we see is that if we can't quantify the problems, we can't then budget for them. And therefore then services can never reach people, because government can only budget for and plan for things that are quantifiable. So the issue of data and statistics is very, very important. It's important when we talk about causes. It's important when you talk about structural drivers. And we need to have these deeper discussions, I think, especially around alcohol and what its role is in violence. In terms of following up on previous recommendations, we know that the Chapter 9 institutions recommendations are legally binding. So one of the tasks that we're continuously embarking on within the Commission is to follow up on those. And as an example, the shelter hearings that we held in December 2019 were actually part of a progress report on the state of shelters that had happened previously. And what has come out of that is that, in fact, in March 2020, the National Minister of Public Works and Infrastructure has committed 6 government-owned properties in the Western Cape that will be made available to be used as shelters, safe havens, or for women and children. And so I think, just in terms of just one example of how the work we do at the Commission can literally be a catalyst for these types of of outcomes, which was really great. And the turnaround for us was particularly impressive, because we know a lot of these problems around shelters and access to property are long-standing issues. In terms of the NSP for GBV and femicide, we were part of the process as the commission, different people in terms of our legal department. We had different provincial managers be part of those consultations, and we had our CEO as well as different commissioners and our chairperson working on different thematic areas and pillars in the NSP, in the consultations, but as well in terms of the process of finalization of that document. And we are currently working on those different pillars to ensure implementation, to ensure that we take the work we have done as the commission, we take the recommendations which are legally binding, and find where in the NSP those issues find expression, and quickly run with those, because those are the low-hanging fruits, where you have a chapter 9 which has already made findings and recommendations that are binding, and you find those same issues are finding expression in the NSP. It's important for the citizens to hold us accountable as the commission, and in turn we will then, as we are mandated, perform our oversight and monitoring on the different role players that are important in this fight around. Actually, no, let's not use the word fight, because we are trying even to change the language, right? And how we call things is important in this process of ending gender-based violence in the country. So I think that was all of the questions that you asked. Yeah.
And thank you, Tlaleng. Quickly, Angeline, any response?
Yeah, thank you. Thanks, Levo. Janine, I think you summed up quite nicely what I was saying, that we really need to be called to action now. But I think the question, how do we bring about a change in mindsets? That's a big question. That's a complex one. And I think we need to be, firstly, maybe perhaps a couple of pointers that come to mind is, we need to think about a person in context. As soon as we think about a person in context, we have to then start thinking about social, economic, cultural, political factors that impact a person's life and their experiences, and how do they intersect, and how get the different types of violence that are enacted, that unfold. How does a person respond? How does society respond? And when I say society, remember, those are just persons in context as well. So it's really about starting there. We also then need to think about, in terms of time, what is happening right now, and also sometime in the future, what is it that we want to do now as almost like an investment in that, bringing about that long-term change and shift in thinking. So when we talk about what's happening now, if you look at, we've been focusing a lot on the survivors of violence, whether it's women or men, but we need to go beyond that and also start engaging perpetrators of violence and trying to understand there and how, where are the points where we can strategically intervene to bring about a shift in mindset there and a change in behavior. In terms of going forward as well, we spoke about curriculum and how curriculum need to change at institutional level. At school level, we have the LO curriculum, and that has been criticized quite a lot. But my question is, why do we not start even sooner and earlier? Why do we wait for grade 10, 11, 12 just to do some course? Learning is ongoing, it's lifelong. When children learn all the time. So we need to have role models, and every one of us here is a role model. So in our spaces, to go back to what I said, if each one of us here thinks critically and reflects on our own positioning and our own roles and what we perpetrate and enforce, etc., how do we then become role models? Go into the formal curriculum as well, looking at our grade R, right down from triple R, and also what happens in our homes and households. How do we change that learning there? So again, it has to go back to the engagement between individual, community, and national levels, and it really has to be in sync, I think, to about some kind of changes. And of course, we cannot, finally, if we want to bring about those changes, we cannot see gender-based violence as being separate from the broader context of violence, whether it's our history of political violence, whether it's ongoing community violence, police violence, and brutality. They are all interlinked and they intersect, and so we have to be dealing with that. So it's a big task, but I think it is one that we do need to tackle. Thank you.
Thank you, Angeline. As usual, there's never enough time for these kinds of conversations. But in the last few minutes that are left, I would like the panelists to take just a minute or two to reflect. If you go through the Q&A button, there are some questions there that have been posed. All the questions are important, but because of time, I've sort of zoomed in on 3 that I think we might quickly reflect on. The first one is in relation to the participant observation that the LGBTQI community tends to be overrepresented in our responses to, or in our discourse around violence against women. And this has silenced violence against the elderly, against people with, women with disability and other marginalized groups. How can we shift this discourse? The second question is the silence around the murder of men and boys. And the question is, how does this feature in the GBV response in South Africa? And linked to that, how might such a response be initiated if you wanted to initiate it? The last question is, violence tends to be racialized in addition to being gendered. Would the panelists agree that South Africa's response does not adequately address the needs of Black women? For example, the criminal response has not worked. So why do we continue to pursue it as a response? Quick responses from the panelists.
I'll start with the last one simply because it's the one in my head, Label. I don't think one can say the criminal justice system response hasn't worked. That's too blanket and general a claim. It works for some women occasionally, it doesn't work for all women. I think what we also need to start thinking is moving away from the idea that there is one solution that will work for all women. What we are challenged to start thinking about is multiple solutions to accommodate multiple women's differently placed circumstances and positions in life that will assist them. I certainly would not wish to see us abandoning the idea of protection orders, for example. They have saved some women's lives, they haven't saved others. So I think the criminal justice system works sometimes. Let's see what we can do to make it work better for those for whom it does work. But let us think beyond the criminal justice system around what are all the very many other things that we could be doing. And that then might link to the point of how do we expand who we think of when we use the word or think about ideas around who is a woman. Because clearly there is no one woman who can be representative of all women. There are many different kinds of women. And so again, if we're thinking multiple responses, we need to think about, in this kind of response that we are designing, who is being left out? Who will this not be thought? Who is not being thought about here? How do we think about how we craft responses that recognize immediately that women are differently situated? So I think those 2 questions really do, in some ways, belong and go together with each other. The question of violence against men, I think, is extremely important for us to think about, because there is certainly a suggestion that where there are high levels of violence towards men, there are high levels of violence towards women. So if we look at our homicide statistics in South Africa, for example, South Africa's homicide statistics for women are 5 times the global average, but so are those for men. And if we look at where South Africa ranks in terms of homicide rates globally, we're sitting about 4th. below Jamaica, Lesotho, and the country with the most extraordinary levels of murder, Honduras. But that is for both men and women. So I think we need to be thinking about how does gender shape the experience of violence differently, so that when you're a man, you're murdered under one set of circumstances, and when you're a woman, you're murdered under a different set of circumstances. And how is it that the common denominator in both circumstances is almost always a man? So I think, we should think about gender not just as being a marker of identity, but also a system and a way of ordering relations in multiple dimensions and across multiple roles. So it's not just man, woman, it's father, daughter, son, mother, cashier, nurse, doctor. Those are all quite gendered relations as well. And I think it's for us to think about how do they organize the way people interact with each other, both hierarchically, as well as who is permitted to do what help is available to who, how we think about people and what is appropriate to them. That's a very quick response.
Thank you, Lisa. Ali, Dr. T, Angeline? Quick responses, quick last words from you.
So to echo Lisa Vetten, especially in the violence against boys and men, this can be similarly understood as patriarchal violence, although it is not gender-based violence, seeing as it's not against women and non-binary persons. However, with men being the common denominator, we still need to have a discussion about violence as a relational tool, as part of the patriarchal identity of masculinity, it being about control and domination, and about power. So it is quite a relevant discussion to have, but it's a discussion that's not entirely divorced from, oh, sorry about that. It's a discussion that is not entirely divorced from GBV. And furthermore, I think in the question about, I've forgotten the other questions.
That's okay.
Okay.
Okay, go ahead.
I'll allow the other panelists to continue.
Okay, Dr. T? Is she still around? Yes.
Yeah, I'm here. So I think in my closing sort of remarks, just generally, is you'll often hear, people who want to be allies, right? To women, children, and those who are vulnerable. And you will hear them, say things like protect our women or protect our girl children. And for me, then the question becomes, who and what do women and girls need protection from? And when will we deal as a society with that children and women need protection from? And I think, the issues of gender-based violence, because they are so much about power and being aware of this undue power and privilege that societies have arranged, right, and given to those who are men, they need to interrogate what that power means and be conscious to what that power means and how it exerts itself in different spaces. And how we discipline children is also important, because if you keep using violence to discipline children and then say, but it's because I love you, I'm your parent, I'm trying to teach you the best, we are saying to children, it's fine that their dignity gets eroded, that they are violated, because the reward is love. And if you see how intimate partner violence works when in adults, you can see that dynamic come through. So there's so much that can be said and done. But I think just in parting, I think those are the two sort of questions and provocations that I would like to leave, on the panel. Thank you,
Thank you, Tlale.
Lebo, yeah, just a very quick one from me, because I have my fellow panelists have already said quite a bit. I think just lastly to say that when we look at all of this, we do need to think in terms of maybe just our identities, how we construct identities, our identities, and the meanings attached to it, and especially in relation to the whole concept of citizenship, and how this relates to to violence, because I think if we tackle the whole issue of citizenship as well, it also forces us to shift and bring about the changes that we've also been speaking about. Thanks, Lebo.
Thank you. Janine, a last word from you.
Thanks, Lebo. I'm just going to draw the recommendation that Lisa made. I'm hearing this body of work that is needed, and perhaps that's the challenge now to us as an academic institution, working with our partners in civil society and with the Gender Commission, tracking, what has changed in our response to gender-based violence, what has been effective, what was not effective, mapping those shifts and those trends, the different factors that might impact on gender-based violence, what shapes the gendered impact of violence on women and men, how do we understand it, how do we track it? I think that's a critical body of work. We must not lose sight of that recommendation, but otherwise, thank you.
Thank you. We are sort of out of time. So I would like to thank the panelists for wonderful presentations and wonderful conversations. I would also like to thank the participants for the questions that they have posed on the Q&A button. These questions will help us going forward in thinking about our response as an institution under the leadership of Janine and other colleagues. Watch the space, because our belief is that these conversations cannot be just once off. We have to keep on checking up with each other. How far are we? Where are the gaps remaining? And so on. And so thank you very much. From my side, that is it. Thank you.